Good evening. New studies suggest more children than ever are being prescribed psychiatric drugs and other serious medications.
In tonight's special report, Fox 7's Scarlett Grayson tells us what precautions you should take before allowing your kids to take a pill. She's here in the studio tonight with the alarming statistics. Scarlett?
Mike and Christine, it takes a lot more than a simple checkup to determine if a child should be put on medication. I spoke with a psychiatrist and psychologist who believe some children could be facing long-term health risks because they're being diagnosed too quickly.
It's not uncommon for people to look for quick fixes for medically related issues.
How about some quick fixes for your children? Are they misbehaving? Give them some pills. Bad grades? Pills. Aggressive tendencies? Pills. It may sound extreme, but hundreds of thousands of toddlers are being prescribed powerful psychiatric drugs, according to the Centers for Disease Control.
Number one, I want to know who is prescribing the medications. Are there people who are familiar with the medicines, who use them on a regular and routine basis?
Dr. Scott Elkin, a psychiatrist who has been in the medicine field for over 30 years, says the numbers of toddlers and infants being prescribed serious medication simply doesn't make sense.
What are the environments in which those prescriptions are being prepared?
Elkin says these questions are ones every parent should ask before they agree to put their child on medication. And licensed psychologist Dr. Jim Whitefield agrees.
The best way to get to the bottom of a child's behavior problem is with a very thorough evaluation.
According to Whitefield, assessments, interviews, interactive observations, family counseling, and more should all be part of the process when evaluating if a child needs medication or simply just therapy. So why are the numbers so high? According to recent data from IMS Health, one of the leading services for data distribution in healthcare, 274,000 infants under a year old are on anti-anxiety drugs such as Xanax and Ativan. And 26,000 under a year old are on antidepressants like Prozac and Zoloft. Those are infants, not even a year old. These numbers don't even compare to the millions of children 5 years and under being prescribed these same drugs.
They're absolutely outstanding. It's unbelievable that this many kids would be, young babies and toddlers, would be on medication because there's absolutely no evidence it works.
Dr. Alan Francis, the author of Saving Normal, says one of the main issues is that most psychiatric medication is not prescribed by psychiatrists.
Most of it is prescribed by primary care doctors who often don't know a whole lot about psychiatry. They get a lot of their information from drug salesmen.
And Francis is not the only one who believes this could be a problem. Do you feel like that could be a factor in some of these statistics? Is that the wrong people are prescribing these drugs?
I won't say that the wrong people are, but I'm saying that given the nature of the healthcare system at this time, that when you go into a primary care doctor, they say that the average amount of time that you'll spend in their office is 7 minutes. And then a prescription is written to be able to create some peace within the home environment rather than addressing the underlying pathology.
Elkin says it takes weeks and multiple follow-ups before medication is his last resort for a child. So what other factors could be contributing to these alarming statistics?
I'm wondering if the large number of kids taking medication for, overactivity. I wonder if they just had recess a couple of times a day, if it would help them.
Whitefield spent over 20 years in the education system, and he and Dr. Francis say schools may be playing a large role too.
We have classes that are too big. There's not enough physical activity for kids. And instead of solving an educational problem with educational solutions, we're taking the most vulnerable kids in the class and giving them a diagnosis and often giving them unnecessary medication.
Francis says almost all of the prescribing that's happening is off-label, meaning there hasn't been studies that document the effectiveness of the drugs or monitors their long-term risks.
There's just no shortcut to it. It's a very thorough evaluation that takes a lot of time.
Dr. Francis added the best protection for a child is an informed parent, and that you should never accept mediation or diagnosis for your child without asking tons of questions. Back to you.
Scarlett, thank you.